Assalamu alaikum doctors, welcome to my YouTube channel MBBS and BDS lectures. Today is the 14th video of repeat revision course of Periodontics, which is very important for NLE, MDS, NBD as well as for BDS students. In this video we will discuss about a second part of defense mechanism of oral cavity or defense mechanism of gingiva. In 13th video we already discussed about the first part of defense mechanism, which was saliva, but today we will discuss about GCF, gingival crevicular fluid, in detail. Here for MCQ's point of view, there are very important points regarding to GCF, like method of collection. Basically it is exudate, and next which condition stimulate the GCF flow, and in inflammatory condition the GCF flow, and a method of collection of gingival crevicular fluid. These are very important. Next is the drugs which are excreted from GCF. These are very important. First we start from definition of GCF. What is GCF? Gingival crevicular fluid is an inflammatory exudate. There is exudate and transudate. In transudate there is no cell, only plasma which leak from the blood vessel, but in exudate there is the cells, proteins, because in inflammation the permeability increase, vascularity increase. In the result there is cell which move outside of the blood vessel. Now in GCF is an inflammatory exudate, mean it occur in inflammation from leaky venules. It come from leaky venules adjacent to the sulcus and junctional epithelium, because it is present in sulcus, mean in gingival crevice, therefore known as gingival crevicular fluid. Now after definition, come to the functions. There are three functions of GCF. Number one is the flushing action, cleaning action. They remove the substance from gingival sulcus to clean it. Second is the presence of cellular and humoral immune components are present in the gingival crevicular fluid. Therefore, it acts as a defense mechanism of gingiva or oral cavity. For example, cytokines. Third, presence of diagnostic and prognostic biological markers. These are present in GCF. When we collect the GCF, from this GCF we can diagnose the condition, mean presence of diagnostic and prognostic biological markers. These are the three functions of GCF. Now come to the clinical significance. Following factors stimulate GCF flow. Number one is the gingival inflammation. In periodontitis, gingivitis, the GCF flow increase. Second is the toothbrushing. Toothbrushing increase GCF flow. Third is the gingival massage, and fourth is the smoking. We will discuss in next videos, in coming videos, effect of smoking on periodontium. In that video we will discuss about smoking which increase GCF flow. After clinical significance, now come to the method of collection of GCF. How we collect the GCF from gingival crevice. Various methods are used. There are four methods. Number one is the absorbing paper strip. Second is the twisted threads method. Third is the micropipettes, and fourth is the intracrevicular washing. Now come to the first method, which is the absorbing paper strips. Here we place paper strips, and when paper strip is wet, then these paper strip we place in a electronic transducer, which is a periotron, which measure the fluid which are collected in the paper strip. Then in this absorbing paper strip, there are two methods. One is intracircular, mean inside the sulcus we place. One is extracircular. We do not place paper strip inside the sulcus, but at the entrance of the sulcus. When we place intracircular, this method is known as Brill method. Now in absorbing paper strip, these strips used in two methods. Number one is the intracircular method, which is in figure 4.A to C. In A there is the intracircular method. In intracircular method, which is also known as the Brill method, paper strip placed in the sulcus. Second method is the extracircular method, which are in B and C is the extracircular method, mean at the entrance of gingival crevice sulcus we place the strip. Paper strip placed at the entrance of the sulcus. Then we evaluated by perio paper or blotter, which use as a electronic transducer, which is the periotron, to measure the fluid collected. Mean that these fluid collected we measure by with the help of electronic device, which is a periotron. Now come to the second method, which is the twisted threads. Here we place twisted threads. They are placed around and into the sulcus, then calculated by weighting the removal thread. Then we weight the removal threads. The removed threads mean initially and after, mean before and after. After weighting, its weight will be increased. Third is the micropipette method. Here we place micropipette. By capillary action, fluid will be collected in the micropipettes. Fourth method is the intraclavicular washing. In intraclavicular washing, a hard acrylic plate covering the maxilla with soft border, mean we place in maxilla a hard acrylic plate which cover the maxilla with its border is soft and groove in order to follow the gingival margin. Then it is connected to the four collection tubes. Then washing is obtained by rinsing the clavicular area from side to side. We rinse and this fluid will be collected in the four collection tubes. This is the intraclavicular washing methods. Now these are the four methods: absorbing paper strip, twisted threads, micropipette, intraclavicular washing. Now the important points: in absorbing paper strip we use periotron. Next, in twisted thread we use thread. In third, in micropipette, with the help of capillary action, micropipette collect the fluid. And in intraclavicular washing, the four tubes are connected with a acrylic plate which have soft border and groove. And then washing is obtained by rinsing the clavicular area from side to side. Now come to the amount of secretion. How we measure the amount of secretion? By a perio paper and with the help of periotron, which is an electric transducer device. Now 0.1 mg, these points are very important for MCQs, this value. 0.1 mg of GCF in 3 minutes from slightly inflamed gingiva, and 0.43 to 1.56 microliter in proximal spaces in molar region. Now come to the permeability of junctional and circular epithelium. Mean the junctional and circular epithelium are permeable to which substances? Substances that penetrate circular epithelium are the albumin, endotoxin, thymidine, histamine, penetoin, which is the anti-epileptic drug, and next is the horseradish peroxidase. Now come to the composition of GCF. The component of circular fluid can be characterized according to individual. Number one, protein. Second is the specific antibodies which present. Third is the antigen. Fourth is the enzyme of several specific sites. And next is the cellular element like bacteria, desquamated epithelial cell, leukocyte. Next is the electrolyte like potassium, sodium and calcium. Third is the organic compounds like carbohydrates and protein. Now factors that affect the GCF. These are the 5 factors. Number 1 is the circadian rhythm. There's increase in GCF from 6 a.m. to 10 p.m. then it decrease. These are important. Means our circadian rhythm also affect the flow of GCF. There is increase in GCF from 6 a.m. to 10 p.m. Then it decrease. Second is a sex hormone, female sex hormone increase GCF. Third, mechanical stimulation, chewing and gingival brushing increase GCF. Fourth, smoking cause immediate increase in GCF. Fifth, periodontal therapy, GCF increases after perio surgery. Now, what are the differences? These are very, very important. What are the differences between our body serum and saliva and GCF? First, glucose concentration in GCF is 3 to 4 times greater than that in serum. Remember, glucose concentration in GCF is 3 to 4 times greater than that in serum. Means in serum there is a less glucose. In GCF, the glucose is 3 to 4 times greater. But total protein content of GCF is less than that of serum. Mean in serum the protein content is in GCF the protein content is less than serum, but glucose concentration is 3 to 4 times greater. These values are very, very important. Next is that there is no correlation between concentration of protein in GCF and severity of gingivitis, pocket depth or bone loss. Next, GCF, inflammatory exudate and amount increase with inflammation and may be proportional to severity of inflammation. If there is a more severe inflammation, there will be more GCF. Next, antibodies in saliva is IgA, IgG and IgM, but the main class is IgA. Next, what are the drugs which excreted through GCF? These are the two, tetracycline and metronidazole. These are the two antibiotics which excreted through GCF. They can also ask in MCQs which drugs are excreted through GCF. These are the tetracycline and metronidazole. Next is the leukocytes in dentogingival area. There is the main port of entry is the oral cavity for pathogens. In healthy human gingival sulcus, these are very, very important. There is 91.2 to 91.5 polymorphic mononuclear leukocytes. Next is the 8.5 to 8.8% mononuclear cells. Then in mononuclear cell there is a 58% B lymphocyte, 24% T lymphocyte, 18% mononuclear phagocytes. Now, here the important point is, this is very, very important for MCQs. Normally in our body blood, the T lymphocyte is more, B lymphocyte is less. The ratio of T to B lymphocyte is 3:1. Mean there is 3 T lymphocyte, there will be 1 B lymphocyte. But this is very, very important. In GCF, the process is reverse. The 3:1 ratio is reversed into 1:3. There is a 1 T lymphocyte and 3 B lymphocyte. The B lymphocyte count in GCF is increased. Now here, ratio of T lymphocyte to B lymphocyte found to be reversed from normal ratio of about 3:1 found in peripheral blood to about 1:8 into 3 in GCF. Now the important thing is, in GCF the glucose concentration is greater than blood. Next, B lymphocyte ratio is greater than T lymphocyte. In blood, as compared to blood, the protein concentration compared to blood serum is less in GCF. This is all about gingival clavicular fluid, which acts as a defense mechanism of gingiva, because here the defense cells are present and they help in washing up gingival clavicular fluid, and also cytokines are present in GCF. Now today our topic is complete. If you like my video, press the like button and share this video with your friends. If you're new to my channel, subscribe my channel by pressing the red subscribe button, and also press the bell icon in order to receive my each new video notification. And there are more than 530 videos of different subjects, of every subject of BDS and MBBS. The repeat revision courses are present in a playlist section. You can check and watch this video also, and also share link with your friends. For watching my videos, I am very thankful to you. Thank you very much.